Let's use complete anatomy to examine the skull and its foramina, or holes. Starting with the flat cranial bones, we see the frontal bone. There are two parietal bones, left and right. Here we see the temporal bone, and down low and in back, the occipital bone. You may recognize these names, which correspond to the lobes of the brain. Each lobe is named for the overlying bone. The skull has many complex bones that form the face. Let's identify a few major facial bones. At the margin of each orbit, we have, again, the frontal bone. Laterally, we see the zygomatic bone, or what's commonly called the cheekbone. Inferior-medially, we find the maxillary bone, which has sockets for our upper teeth. At the back of each orbit lies the sphenoid bone, a wedge-shaped bone that stretches the width of the skull from right to left. Finally, we have the mandible, or jawbone, which articulates with the temporal bones at the TMJs, the only mobile joints between bones of the skull. Next, let's take a look inside the cranium. I'll hide the parietal bone on the right to expose the cranium. Looking inside, we see three regions. The first, up high and in front, is the anterior cranial fossa, which normally houses the frontal lobes of the brain. Next, we see a bow tie-shaped region in the middle of the cranium, the middle cranial fossa, which normally houses both temporal lobes laterally and the pituitary gland in between. Finally, down low and in back, we see the posterior cranial fossa, which normally houses the cerebellum and brainstem. Let's change views to emphasize the foramina, or holes, and relate them to key nerves or vessels they transmit. In the anterior cranial fossa, we find a collection of pinholes, the olfactory foramina. These transmit cranial nerve 1, the olfactory nerve, which is actually a collection of many tiny nerves conveying our sense of smell from olfactory receptor neurons located in the nasal cavity just below. In the middle cranial fossa, we see the optic canal, which transmits cranial nerve 2, our optic nerve. Stepping inferior-laterally, we see an irregular slash, the superior orbital fissure. The superior orbital fissure transmits many important structures, including cranial nerves and blood vessels. Cranial nerves 3, oculomotor, 4, trochlear, V1, the ophthalmic division of cranial nerve 5, trigeminal, and 6, abducens, all pass through this fissure. Next, we see a round hole, foramen rotundum, which transmits V2, the maxillary division of the trigeminal nerve. Posterolaterally, we see an oval hole, the foramen ovale, which transmits V3, the mandibular division of the trigeminal. Posterolateral to that, we see a very small hole, the foramen spinosum, which transmits an important blood vessel, the middle meningeal artery. In the posterior cranial fossa, we find the internal acoustic meatus, which transmits two cranial nerves, 7, the facial nerve, and 8, the vestibulocochlear nerve. Below that, we see an irregular jagged gap, the jugular foramen, so named because several large veins converge here to form the internal jugular vein, which drains blood from the brain back to the heart. The jugular foramen also transmits cranial nerves 9, the glossopharyngeal, 10, the vagus, and 11, the accessory. Near the bottom of the posterior cranial fossa, we find the hypoglossal canal, which transmits cranial nerve 12, the hypoglossal nerve. Finally, we see the largest hole, the foramen magnum, which transmits the spinal cord. Those are the major bones and foramina of the skull.